and welcome to the next part in our series of Boulder Healthier Winter webinars. Today's topic is respiratory health and smoking. The Boulder Healthier Winter series is intended as a series of practical resources to enable professionals and community leaders with direct reach within their communities and establish trusted relationship to support their communities to improve their overall health and well-being. Talk about the subject of respiratory health and smoking. I'll pass over to Dr. Ramachandran.
Hello, my name is Dr. Raj Ramachandran. I'm a GP respiratory specialist working in Birmingham. Today, I want to talk to you about the huge impact smoking has on respiratory illnesses. We know around 78,000 people in the UK die from smoking-related disease each year. And looking locally in Birmingham, we know that more than half of all deaths in Birmingham each year is related to smoking. Approximately 178,000 smokers we know are smoking in Birmingham. And it's really important that we try and address the issues that's raised through smoking. We know respiratory illnesses affects the lung and can result in many symptoms, especially breathing difficulties. Smoking tends to worsen some pre-existing respiratory conditions such as asthma, and if you get even the common cold. Smoking is also a leading cause of heart disease, COPD, and diabetes. And we know all of these are risk factors for COVID-19 infections. Let's talk a little bit about COPD. COPD actually refers to a group of lung conditions characterized by airway or breathing tube blockage that occurs. When you have COPD due to smoking, there's inflammation in the lungs, and the lung tubes or breathing tubes get swollen, they get thickened, and the mucus glands that produce mucus tends to clog up the airways and narrow the airways. The lung, which is normally an elastic structure as you breathe in and out, becomes less elastic and is not able to stretch and shrink when you breathe, so not allowing air to go in and out of your lungs properly. We know around 1.4% of people in Birmingham have COPD. This is probably an underestimate, but it is a lot of patients. And we also know that the main cause for COPD, certainly in the UK, is due to smoking. So the likelihood of developing COPD increases the more you smoke and the longer you smoke. But there are also other causes of COPD, perhaps not seen as much here as in other countries, such as exposure to occupational dust, like coal and silica, and also indoor fossil fuel burning. But the critical cause here in the UK is due to smoking. And quitting smoking can significantly reduce your chance of developing or even preventing further damage to it. Often at the beginning with early COPD, people do not get many symptoms. And we describe this condition as a slowly progressive condition. They may notice that they have breathlessness on exertion initially, and then it becomes more so even at rest. They could develop a persistent cough, which can be troublesome. It usually starts with a cough in the mornings, which they just put it down to smoker's cough, but actually it is the start of COPD. They are more inclined to develop frequent chest infections initially during the winter months, then it becomes more and more frequent as the disease progresses and gets more severe. They will hear a wheeze, which is air going through a narrow breathing tubes, which produces a whistling sound. As they develop more severe disease, they can get tiredness, weight loss, ankle swelling, and even heart failure. So it's important to try and diagnose the condition early and treat it to prevent further damage to the lungs. The other big impact of smoking on lung disease is lung cancer. Smoking is the most common cause of lung cancer. Around 70% of lung cancers are due to smoking. We know that over 47,000 people are diagnosed with lung cancer each year in the UK. Smoking 25 cigarettes a day puts a person at 25 times higher risk of lung cancer compared to non-smoker. Tobacco smoke has over 7,000 chemicals, over 250 toxic chemicals, and more than 60 of these toxic chemicals can cause cancer. The best way to prevent lung cancer is to stop smoking as soon as possible. However long someone has been smoking, it's always worth quitting. Each smoke-free year decreases the risk of serious illness. Lung cancer is often diagnosed late, and the long-term 5-year survival rates are poor. With this in mind, NHS England has made available this program of targeted lung health checks across Birmingham and Solihull. People over the age of 55 to 74 with a smoking history, either current smoker or ex-smokers, will receive a letter, an invite from the NHS for them to come in for a lung health check. This will involve having breathing tests, x-rays, and those with a higher risk of possible lung cancer will also have a special lung scan to assist with the diagnosis. People who smoke generally have an increased risk of getting respiratory infections. And when they do get them, often they have more severe symptoms and it lingers longer than for a non-smoker. If you're a smoker, you're twice as high risk of developing pneumonia when you get an infection, and 5 times more risk of catching the flu. Smoking tobacco is a known risk factor for more severe respiratory infections, such as the severe acute respiratory syndrome or the Middle East respiratory symptom related to coronavirus infections. There is evidence that smokers fare worse and more likely to suffer severe outcomes with COVID infections, such as admission to intensive care unit, having to be ventilated, and even dying from their COVID infection, when compared to people who have never smoked. Smoking again has a huge impact on pregnancy. Stopping smoking during pregnancy is the single most effective thing a mother could do to protect the unborn child. We know around 12% of women who are pregnant in Birmingham smoke. Smoking increases a number of risks for both the mother and for the infant, including premature deaths, miscarriages, and perinatal death. This is death that occurs to the fetus or baby between 22 weeks of pregnancy and 7 days of birth. Asthma also has increased risk of developing asthma in women who smoke. Their children are more likely to get asthma, and other kind of upper respiratory infections, ear infections, are more common in smoking There is plenty of support and help to give up smoking in pregnancy, and I think having a choice, I'm sure the unborn child would not want their mother to smoke. So this is a really good opportunity for stop smoking. Secondhand smoking or passive smoking can also increase the risk of developing the same health conditions as smokers. So the only way to protect people from secondhand smoking is to keep the environment around them smoke-free. Simply opening the windows and doors or smoking in another room doesn't protect people. If people are not ready to quit and smoke, they should smoke outside, preferably, and not smoke, for instance, in a car, which all increases the risk of passive secondhand smoking. There are huge benefits in stopping smoking. Notwithstanding, you will save some money, but also smoking reverses some of the damage that can occur and improve lung condition. When you smoke, you produce carbon monoxide, and within 48 hours of quitting smoking, carbon monoxide is flushed out. Within 2 to 12 weeks after quitting, your blood circulation improves. And within 3 to 9 months, your lung function test could improve by 10%, and you have less respiratory symptoms such as breathing problems. And a year after stopping smoking reduces the risk of heart attack by half. 10 years on from stopping smoking, the risk of death from lung cancer is also halved compared to a smoker. Smoke-free homes will protect loved ones and pets. Stopping smoking can help boost mental health and well-being. There's also benefits with dental health, and it's less likely in non-smokers to get gum disease or premature loss of teeth. Finally, it also reduces the unnecessary pressure that's put on the NHS. We recognise that smokers have to face many barriers with quitting smoking. It's simply not that easy to do so. As we know, nicotine is a highly addictive drug. And they worry about nicotine withdrawals, worry about the craving, the triggers, and the stress. Some people complain of weight gain, and appetite also increases because they substitute food for cigarettes. They could get mood swings, and it can have an adverse effect on their existing mental conditions such as anxiety. Smokers may not be aware of the services that are available out there and the interventions such as nicotine replacement therapy, which they may perceive as being expensive and ineffective. There's also the fear that they may not be able to give up, the fear of failure, fear of being judged. And we may be removing what cigarette is as a coping mechanism. So what can we do to help? And what professional help can do for quitting smoking? We know around 60% of smokers in England want to quit. And at any one time, 10% of whom want to do so within 3 months. But currently, almost half of people who quit smoking do so with just willpower alone, which is actually the least effective method to give up, to quit. With a bit of help, you could increase your chance of success. So if they had nicotine replacement patches or e-cigarettes, that increases the success rate by 1.5. And if they had prescribed medicine to quit smoking from a health professional, that increases success rate by 2. And if they have the combination of smoking aids and expert advice and support from Stop Smoking Services, this could increase the success rate up to 3 times. There's plenty of services available out there to support people give up smoking. GPs and pharmacies across Birmingham can offer 12 weeks of treatments, support and advice. There are over 300 stop smoking locations across Birmingham, offering a whole variety of different professional community support and nicotine replacement therapy. The resources are available to everybody in Birmingham. There is very many. We need to signpost people to these appropriate services, websites, online help, and various other ways that people can access this help. People who successfully quit for 28 days are 5 times more likely to quit for good. So the important thing is to support them through that month of stopping smoking. Stop October is one way of doing that, encouraging the nation to stop smoking, to quit an attempt for the month of October every year and beyond. So I hope I was able to stress the importance of supporting people to give up smoking and the benefits, the health benefits, not just respiratory, but other benefits from stopping smoking. I'd be grateful if you could share this message and encourage positive health within your community. Try and help spot people who may need your support. Promote these webinars in your network. Thank you very much for listening.
Thank you, Dr. Ramachandran. If you're enjoying these sessions and enjoying promoting positive health and supporting your community to improve their health and well-being, want to be more involved, you can volunteer to become a Boulder Healthier Champion. Boulder Healthier Champions are advocates for important health messages in Birmingham. They distribute information to a wide range of communities and networks. Your role as a Boulder Healthier Champion will be to share the information into your communities to encourage and support health and well-being. We will support you through monthly themed webinars and tailored resource packs. We've previously covered physical activity and how it can be incorporated into our daily lives, as well as the benefits of increasing regular activity, even in small ways. We've also covered topics such as cost of living and diabetes. If this is something that's you're interested in signing up to, then please either search for Boulder Healthy Champions, Birmingham City Council, or by clicking on the link when you receive this slide deck. And thank you for watching today.